Courtney Smith is 10 years old. A few weeks ago, she developed a cough, so her parents took her to the doctor. At the doctor's office, they performed a sweat chloride test. She tested positive, so she has a new diagnosis of cystic fibrosis. I met with the family to discuss this new diagnosis and just give them an overview of the disease. Upon assessment, I did hear wheezing and crackles in her lungs. Everything else was pretty normal, except she does have hyperactive bowel sounds and she has loose frothy stools multiple times a day. She is on a few medications. Her current medications are pancreolipase, 3 capsules with meals, 1 to 2 PO with snacks, Zithromax 5 milligrams per kilogram by mouth at 12, Pulmozyme 2.5 milligrams nebulizer every day, and levobuterol 2.5 milligrams via nebulizer 4 times a day. She also takes a multivitamin 2 times a day by mouth. She has a mucus clearing device that she will need to use, and she will also get chest physiotherapy. She's very excited to learn about cystic fibrosis. She was interested in telling all of her friends at school, so I educated her and her parents about the disease. Her parents did mention she's a very picky eater, and I discussed the importance of a diet and high in protein and calories with her. We also talked about what food she does like, so she will be more willing to eat. Courtney also visited the school nurse to tell her about her cystic fibrosis and the medications she will need to take at school. I as well spoke with the school nurse, and he told me about a support group that another student with cystic fibrosis goes to. He had a few questions about the mucus clearing device, and we cleared all those up with him. When I met with her again, Courtney said that she felt like she was coughing even more, and she was coughing up some yellowish sputum. I discussed how important it was to continue the physiotherapy and take her medication so that her cough does not get worse. Her softball coach also came to one of our meetings to discuss her activity level due to her cystic fibrosis. I educated both of them that she can play softball as much as she would like to, as much as her pulmonary system will allow. The next time I met Courtney was at a friend's house, and when she came back home, she was kind of upset that she had to come home to take her treatments because her friends, they didn't have to do this well. I once again just explained to her how important it was for her symptoms and for her disease that she adhere to her medications and her therapies. She also stated she had a softball game and she got kind of tired, but she is still continuing to play, and I discussed that softball is good for her, that it helps with her pulmonary health. Her parents, I also gave them a pamphlet about cystic fibrosis support groups for parents, and they seemed really eager to want to go to one of those meetings.